Hey everyone, it's Dr. Sonia. Welcome. This is the first of a series of topics that we're going to be talking about over the next several weeks and months. I'm so excited to have you guys here, and I'm so excited to introduce my personal friend, Onelia, who's also a beauty blogger, a beauty enthusiast, and a social influencer. We are going to be talking about a lot of things under the sun, everything from beauty to wellness to how to take care of yourself to holistic medicine to lifestyle medicine, so make sure you join us. Top 4 things I think that millennials want to know, and I get asked this all the time, which is preventative skincare. What should the skincare routine be? Botox and when to get started. Number 3, the use of photofacials and chemical peels. And lastly, body sculpting. So number 1 is getting started with skincare. It doesn't make sense to spend a whole lot of money doing all these other things and procedures if you don't get started with the basics. And the number 1 rule of thumb is start with sun protection. Avoid the sun, avoid tanning beds, absolutely, and start with SPF 30 with zinc oxide every single day. Number 2 product is retinol. So retinol is a vitamin A cream that everyone on the planet should be on. It really is gold in a bottle. It helps with reducing fine lines and wrinkles and helps exfoliate your skin. It helps with lightening brown spots and building collagen. It is something that you want to get started with as soon as possible.
Number 2 is Botox. I always think that, should I get it? Should I not get it? Where do I get it? I know it's a preventative measure, so tell me more about that.
The umbrella term is neurotoxins, and there's a wide variety that are available. Botox is like the gold standard that everybody knows by brand, but there's also Dysport, there's also Xeomin. They're all used quite commonly and very equally in my office. What I love about them is the fact that I can do a lot more with prevention than I can after the line has formed with treatment, because I would rather do things that are non-invasive or minimally invasive whenever I possibly can rather than go to surgery. So number 3 question that I get from millennials also is, when is a good time to think about lasers and things like photofacials and chemical peels, and again, more of these non-invasive and minimally invasive options. I love it because it will help to stimulate collagen, it will help with pores, it will help with lines and wrinkles, it will help with brown spots, especially because I do see a lot of the younger population doing tanning beds, which is such a no-no, and all these other things, and baking in the sun, and so I start seeing lines and some premature aging, including brown spots. So IPL or photofacials become a really good, important source for helping to eliminate that problem. Peels are another way to do that. They may have a little more downtime, but it just kind of keeps your skin looking fresh and young and has that glow with it, helping with exfoliation. The last concern that I do get in the office a lot are some of my young patients who just want to do some more body sculpting procedures. And some of this could be the Kardashian effect, and what can I do about enhancing my lips, and what can I do about enhancing my shape. So cool sculpting becomes a really good, viable option. Now, the way we do it is a little bit different in that I want to see results. I want to make sure that I am doing everything that I can for my patients. So I actually combine 3 FDA-cleared devices where I can enhance not only fat cell death, but also allow for the elimination and tightening of the skin at the same time. So it is for that particular group that is doing everything that they can to lose it on their own, holistically, diet, exercise, lifestyle, staying active to do it on their own, but they just have that little bit of pinchable fat that they can't quite get rid of. I wanted to reiterate was the fact that it all starts from within. It all starts from us. So wearing your sun protection every single day, because it doesn't make sense to spend a whole lot of money unless you do that number 1 step. The 2 things that everybody should be on, literally on the planet, is sunscreen and retinol for the rest of your life, and the sooner the better. It's much easier to prevent than it is to treat, and I can tell you that all day because I do it all day. And then finally, there's a lot of holistic measures in which to get some of this stuff done, including fat freezing and things like that are done during your lunchtime, no downtime, done in the office, very simple and easy. So I think the millennials really have a menu of things that they can call on, and it will be all very beneficial for them.